Congratulations, you did a wonderful job with your phase 1 braces, and now it's time to keep your teeth where we put them. For your phase 1 retainers, the retainers are prescribed for each patient individually. So you may have a different type of retainer than your friend has or even a sibling has. The phase 1 retainers are typically very important to wear for the first 3 months for 12 hours a day. So usually what I would tell you is if you get up in the morning for school at 6 a.m., try to put the retainer in around 6 p.m. the night before and wear it all through the night. You can wear it at home if you do want to eat something. Just take it out to eat, make sure your teeth are clean, and then put it back in. In general, wearing the retainers is an extremely important part of keeping your teeth where we put them, but it's also very easy. You just have to remember to do it. When you first get your phase 1 retainer, we will give you an instruction sheet about how to take care of it and answer any common questions that you may have. So please refer to this if I missed something in this short video. With the phase 1 retainers, you do, after the first 3 months, need to wear it every single night to bed. So one way to look at it is if you wear pajamas when you go to bed on your body, you should put tooth pajamas on, which would be your retainers. When you go to put your retainer in your mouth, make sure it is clean. So please brush and floss your teeth at bedtime or before you put it in if it's 12 hours. Also brush the retainer with your toothpaste and your toothbrush. Rinse it out under the sink and then put it in your mouth. When you put the retainer in, it's best not to bite it into place. If you do bite down on it and it's very tight, or if you don't bite on it evenly, you could break the retainer, which is something we don't want you to do. Also, on that note, please keep the retainer high and protected because dogs do love to chew them up, and that can be very destructive to the retainer. They have even been known, we have had multiple reports of dogs chewing through the protective case that we give you. So make sure if your retainer is not in your mouth, that is stored in the protective case and that you keep it safe. If the retainer is rubbing or irritating your gums, you do want to take an emery board at home. I don't have one here at the office with me, but you can just take an emery board like a fingernail file and just smooth down very gently any rough edges. To put the retainer in your mouth, and this patient in particular has a very pretty sparkly blue retainer, you do want to line the retainer up over top of your teeth and then push it into place with your thumbs and your fingers. So again, remember to keep your hands clean when you put it in your mouth. When you put the retainer in your mouth, this is the 3D printed model of this particular patient that we had from their digital impression. The retainer will fit very tight and it will have a little clicking sound or a snap. So when you put it in your mouth, make sure you try to hear that snap. That means that it is seated. Now that snap will lessen over time because the retainer will loosen up. It will be definitely more tight at first. When you first get your retainer, it is definitely normal for your teeth to feel a little bit sore for a few days, almost like you just had your braces adjusted. Please do not stop wearing your retainer. If your teeth are a little bit sore after a few nights of getting used to everything, that will smooth out. You can take some pain relievers like you would take for a headache if your teeth are feeling a little bit sore. More you wear your retainer, the easier it will be to get used to it. So it will not be a problem if you want to wear it more than 12 hours a day. But please, for the first 3 months, comply with the 12 hours a day that we're asking. That will keep your teeth where we put them so your scorching smile stays as beautiful as it is today. If you have a bottom retainer, the same instructions would apply. So you would put the retainer over top of your bottom teeth as well, and you would wear the two of them together at nighttime. Some of you may just have a top retainer, and some of you have a top and bottom retainer. That depends on the severity of the problem and also what the orthodontic work that we did is. When you are coming in for your retainer checks, be sure to bring your retainers to every visit. We call the appointment a retainer check for a reason, and we have to check the retainers. Many of you will, in between stages, have baby teeth that are loose or grown-up teeth that are growing in. So the retainers are designed to accommodate that. However, if one of them stops fitting for any reason because of a tooth falling out or a tooth growing in, that's a signal that you should call us so we can adjust or check the retainer. If we need to make adjustments, we will. Normally, when you have the phase 1 retention period, your appointments are further apart. So do not wait the entire 9 months or 6 months till your appointment. If you are having problems, please let us know. So your retention is up to you. Very important part of your treatment, and I know you can do it. We're working as a team to keep your smile as straight and as beautiful as it can be so that you will get your phase 2 finished and have your gorgeous, scorching smile in a timely fashion and as comfortable as possible. Miss you guys. Have a good day.